I'm Cath, fifth semester nursing student. Today's date is September 22nd, 2020, and it's 3 o'clock in the afternoon. I'm going to be going ahead and inserting a catheter into a male today. So before I've entered the room, I've checked that there's an order for the catheter and the size of the catheter that I'm going to be using, as well as any allergies my patient has, especially to betadine or iodine. And I've also checked what my patient's last void time and how much he voided. And I've also gathered my equipment here. So I'm going to go ahead and enter the room. Good morning, Mr. Jones. I'm Gabby. I'm your student nurse today. I'm going to go ahead and insert a Foley catheter into your bladder to get some urine, okay? Does that sound all right? Well, I know it doesn't sound all right, but it'll make you feel better. Can you tell me your name and date of birth? Thank you. First thing I'm going to go ahead and do is raise up your bed. We're going to put you up in a little bit of a sitting position here, okay? Just a little bit. Perfect. Now I'm going to go ahead and move your blanket down, okay, Mr. Jones? I'm going to raise up your gown just a little bit here. And we're going to go ahead and position you with your knees bent and your feet on the bed. Is that comfortable enough for the time being? It won't be too long. Awesome. So the first thing I'm going to go ahead and do, I would perform peri-care with my clean gloves. Afterwards, I will go ahead and perform hand hygiene. And I'm going to go ahead and jump right into my catheter. So I'm going to place my catheter set. Now, Mr. Jones, I'm putting my catheter set in between your legs, so try not to move too much, okay? Thanks. Open away from me, the two sides, and towards me last. Okay, now that I've done that, I can go ahead and put on my sterile gloves. I'm going to start with putting my dominant hand in first. And now I'm going to go ahead and put my non-dominant left hand in. And now I am sterile. So I'm going to go ahead and unbox my kit here a little bit, throwing away anything that I don't need. And I'm going to go ahead and set my additional sterile field down so that I can maximize my space. Perfect. Okay. I'm going to open up my swabs, set those to the side. I'm going to open up my lubricant and dump it in, as well as open up my syringe and hook it up to my tubing. We're a little tangled in here, but we'll get that figured out. Place the tip of my tube into the lubricant, 6 inches or so for a male, and attach my syringe to the catheter. Now that I'm all set up, I can go ahead and clean first. So I'm going to take my 3 swabs. Mr. Jones, you're going to feel me touch you now. So I've broken sterility with my left hand, and I'm going to take 3 swabs, go around, how are you doing? Good? Awesome. Well, we only have 1 more swab, so we're almost there. Throw away my trash. All right, Mr. Jones, it's time for the catheter, okay? So you're going to feel quite a bit of pressure here, but I just want you to take some deep breaths and bear down as if you were going to the bathroom. On my count, 1, 2, and 3. I'm going to insert my catheter until I either see urine return or 7 to 9 inches for a male. I've seen my urine return, so I'm going to go ahead and insert an additional 2 inches. And now I can inflate my balloon. order to check correct placement, I'm going to go ahead and just barely tug on my catheter to make sure it doesn't fall right out, and it didn't, so that means that it's good. I'm no longer sterile since the catheter is in, so I'm going to use these as clean gloves now that I'm just kind of finishing up here. First thing I'll do is go ahead and secure the catheter tube down because we don't want that to pull out and actually hurt the patient pretty bad. We're going to attach it to their upper thigh, not the Y. Next thing I do is clean off my patient from any of the extra betadine or iodine I used. And I'm going to go ahead and place the catheter bag, making sure the tubing stays loop and kink free. And I'm going to place it on the bed here. Clean up the rest of my area. And I'll position him back to a comfortable placement. After doing so, I would go ahead and document the date and time of catheter insertion, as well as how the patient tolerated when I inserted, and I would also obtain the urine specimen and document any of the characteristics that I saw with the urine.